Hello everyone, and welcome to this final closing session of CleanMed Europe 2020 online. Well done, and thank you to all of you that have been with us from the start. I know it's been a busy couple of weeks, but I'm sure you'll agree it's also been an inspiring, enjoyable and really productive fortnight of activities as well. So I'm Will Clark, I'm the Executive Director of Healthcare Without Harm Europe, and I'm here to introduce this session and just to say some brief words to close the conference on behalf of our team. So what a fantastic conference this has been. First off, I said at the opening session nearly 2 weeks ago that this would be a new experience for us. We'd never run a virtual CleanMed conference here in Europe before. So it's been a bit of a voyage of discovery, let's say. But I'm delighted that what we've discovered is that the movement for sustainable healthcare in Europe is absolutely growing. There's clearly increasing recognition and interest in the role that our sector and healthcare workers can play in achieving a sustainable future in Europe. And it's also been a record-breaking year for CleanMed this year. We've had over 1,200 participants register for the conference, which is more than 3 times the number we normally see at these conferences. So that's absolutely fantastic. It's also clear that the work that you're all doing is really making a difference and advancing our understanding about the role that the sector can have in addressing current environmental health issues. And I have to say, I've been really impressed also with the level of engagement and interaction throughout the conference, in spite of the fact that this has been a virtual remote event. One of the primary goals of CleanMed, of course, is to create space for networking and shared learning and cross-pollination of best practice. And so it's great that we've done that. And it's been really heartening to see so much lively discussion taking place as well, both on the Hoover platform and then after sessions via email and on social media. So thank you to everyone that's participated and contributed in this way. And then lastly, I think the quality of the content of the sessions has been absolutely top class. I've certainly learned a great deal. I'm sure you have too. And I'm sure you'll all join me in congratulating both the speakers and the Healthcare Without Harm Europe programme teams on putting together such a rich and diverse programme of sessions for us to enjoy over the past couple of weeks. So overall, it's been really motivating, really inspiring, great to hear about all the amazing work that's going on across our networks, and it gives me great hope and confidence for the future as we move forward together. So we wanted to end the conference on a high note, of course, and to that end, I'm delighted to welcome Healthcare Without Harm's co-founder and global president, Gary Cohen, and also Dr. Nick Watts, the former executive director of the Lancet Countdown and now chief sustainability officer at NHS England. And they're going to be discussing NHS England's recent groundbreaking announcement about their commitment to become the first net zero healthcare service in the world. So Nick's going to be talking about how this came about, what it means in practice, and also, of course, what other healthcare services and systems can learn from this work. I think this is a clear example of leadership for sustainable healthcare. It's really commendable. I look forward to hearing the discussion shortly. Before I hand over to Gary, I just want to say a few final words of thanks to close out the conference. So first of all, thank you to all of our sponsors, so Philips, Johnson & Johnson, Aboca Group and ERM, and also for the individual donations that we've received from conference participants. Your generosity has allowed this conference to take place, so naturally I'm really grateful for that. We've waived all conference fees this year, as you know, and are instead asking for donations. If you'd like to make a donation, there is still time. We'll make sure the link is in the chat there on Hoover. Secondly, I'd like to thank all of our 100 or so speakers for their excellent contributions over the last 2 weeks and for bringing us such fantastic content. And of course, also to all of our participants, all of you guys, for making this such an engaging and lively conference. And lastly, I want to say a big personal thank you to the Healthcare Without Harm Europe team. They've worked tirelessly behind the scenes over the past couple of weeks and actually past 6 months or so to organise and deliver this conference, and it wouldn't have happened without their dedication work. So I think they should all be very proud, again, of what's been a truly outstanding conference. So with that, I'll stop talking and I'll hand you over to Gary and Nick. And if you'd like to ask either of them any questions during this session, then please, as you know, use the session Q&A feature on Hoover, and we'll make sure we post answers after the session closes. So Gary, the floor is now yours.
Thank you so much, Will, and congratulations on a great conference and such broad attendance from so many countries. Nick, we're really excited to talk to you. We've known each other for, seems like more than a decade, from early pints of beer in London pubs. And it's exciting to see you in your new role as the head of the sustainability unit at the NHS. We're also really excited by the commitment that the NHS has made around becoming the first zero net emissions health system. Because we need to mine a lot of the learnings there so we can do this all around the world. That's our role at Healthcare Without Harm. So let's talk about that. Obviously, in many circumstances, many systems find themselves within countries, and the policy environment of those countries can both hinder or hurt the efforts of the healthcare sector to really commit to some kind of zero net emissions strategy. Could you tell us a little bit about what was the policy environment in Britain that helped to create the conditions for this announcement from NHS?
Sure. I mean, I have to say, firstly, thank you. Obviously, thanks for having me. Really, really excited to be here. I've dipped in and out of the conference over the week. It looked really fantastic. There's something special in there about being able to get such impressive numbers coming across to an event like this. And I'm glad that you hope to learn from us. We hope to learn from you too. There's a lot of experience in England and across the United Kingdom in low carbon healthcare, but there's a lot more experience across the world. The policy environment is interesting, and in the United Kingdom, there are a few key factors there that I think are worth bearing in mind. What's important though is that we don't think of any one of these as a prerequisite. We can't wait, right? No one hospital, no one clinician, no one clinic can wait until the macro policy environment at the sort of national stage, level is ready, because we'll be waiting for a while. The Climate Change Act is important in the United Kingdom, right? 2008, pretty impressive piece of legislation holding the government to account for some pretty significant reductions at the time, updated, looking for net zero for the United Kingdom by 2050. That I think is important. It creates a environment of this is the direction, not just that the healthcare system is heading, but hey, the entire country, the entire economy is heading in this direction, and there's great value there. I think the other thing that's clearly happening right now is COP26 is coming home, right? So in the United Kingdom, November 1st, November 2nd, 2021, we'll be welcoming the world to Glasgow to talk about the next 5 years of sort of climate change. And so, again, I think that's important because it gives us a moment to sort of talk about why this is urgent right now. Certainly COVID-19, enormous tragedy though it is, also gives us the ability to think big about sort of what the future of healthcare might look like after a pandemic. And so if there are three policy sort of pieces that matter, it is the Climate Change Act and net zero for the United Kingdom, it's COP26, and it's COVID.
Yeah, that's right. And we look forward to working together around Glasgow to really leverage the announcements and the momentum of NHS with others around the world. We'll talk more about that. So the good news is that you're not starting from scratch, both from the policy point of view, but also, the NHS first developed its carbon reduction strategy in 2009. So you have the benefit of standing on the shoulders of your predecessors, Sonia Rushnick and David Pension. What in the, since that 2009 to now, about 11 years, what has been achieved so far in this strategy toward decarbonizing the NHS?
Sure. You're right. Standing on the shoulders of giants. The important piece there is that they were standing on the shoulders of giants too. This work that the NHS has managed to do over the last 12 years has not been done by the Greener NHS team, which is our new sort of team. It has not been done by the Sustainable Development Unit. It's been done by individuals doing hard, actual work out in trusts, out in clinics. We've just been along for the ride, right? And supporting and providing sort of connection where it's relevant. But the people that have managed to achieve the sort of reductions that the NHS have seen so far, they are anaesthetists, they are nurses, they are sustainability managers, patients, visitors, passionate citizens. But there has been a lot done so far, right? I won't go into the numbers because numbers can be a little bit boring. But if you look at just the direct emissions The reduction from a 1990 baseline for the system, it well and truly exceeds what you would expect to see from the Climate Change Act. It well and truly exceeds the pace of change that we are seeing in the United Kingdom. And that is exciting, and we should be proud of that, and the NHS certainly is proud of that. I don't want to make it seem like we're more impressive than we are, though. Some of that came for free. Some of that came because the energy sector decarbonized. Some of that came because we moved away from certain aerosols for different reasons entirely back in the early 1990s. Where I think we should be prouder is when we take account of our full scope of our emissions profile, not just the things that we control directly, but our full supply chain. And there you end up at about a 24, 25% reduction against the 1990 level. That is really impressive. So there's been a huge amount that has sort of happened there. What it's done is got us to this point where the NHS feels comfortable saying, yeah, we have 12 years of a positive track record, 12 years of expertise. We're going to drastically, and I mean drastically, increase the ambition from where we were only 18 months ago to where we are today, and drastically, and I mean drastically, increase the policy commitment and the capacity of the team to deliver on this. This is not an add-on anymore. This is the future of healthcare for the NHS.
No, that's lovely to hear. That's crucial to hear. What's the role of, just thinking of others on the phone who are in all these different hospital systems and national systems. Tell me about the role of data collection and reporting infrastructure. It seems like kind of crucial piece here.
Yeah, essential, right? You need it to know where you're starting from. You need it to know where the finish line is. You need it to know how close you are between the two. You need it to be able to break the system up and let the pharmacists compete with the nurses who compete with the surgeons, right? So data is everything here. It's boring, but mainstreaming some of this analytics into sort of the core data pipeline is everything. We have spent really an enormous amount of time over the last 9 months getting a really good grip of where we are as a system, where the NHS is a system. Again, building off methods that have existed out there for a while, developed by the team over the last decade. Where we need to get to, though, and give us 2 or 3 years, we need to get to the point where not that we know where our emissions are when we check every couple of years and we do a snapshot and we sort of pull together some assumptions and we do our best estimate. We need to know every week. We need to know every month, every 6 months, where our emissions are, and we need to know not just for the system, but for that individual trust, for that individual hospital. And we need to be able to break it down by mental health trust, by primary care, into units that the healthcare system understand. At the moment, we're breaking our data down into, things that are transferable, I suppose, across countries and boundaries, right? But I bet you if you if you went to me when I was going through med school and when I was working in a hospital, and you told me that the healthcare system was made up of an estates system and a procurement team and a sort of finance team and a food team, I would say, oh, I don't think you understand. No, it's not. It's made up of a medical department and an orthopedics department and a chief pharmacist, etc. So our data needs to shift, right? It needs to shift into something that health professionals on the ground can understand, but also that is useful to hold everyone and indeed hold us to account. I'd like to feel uncomfortable because we're not quite achieving our targets on net zero. Wouldn't that be great if there was a team of people within a healthcare system that we had the data to make them feel uncomfortable and they were being held to account because they weren't getting there and hence they then achieved their target. But yeah.
And is there a requirement for all the trust to report at some granular level at this point?
That's what we need to figure out. So there's a requirement for everyone to have what we're calling a green plan. Everyone needs a strategy. We have a macro strategy for the system, but this system has 1.3 million employers in it, right? Its emissions profile is more or less the same size as the country of Denmark or Croatia. So we have a requirement that everyone has their own strategy that fits into our net zero plan. What we need to do then is figure out how to mainstream some of this data requirements. Some of it is mandated, but not enough, right? Yeah. And we've started with the pieces that are easy to get access to. Usually they sit in estates. Usually they maybe sit where there is financial flows. So procurement is a nice place to sort of look at next. But we need to get much, much better at that. So we're not there yet, but that is probably the immediate next step, is to start to mandate some of this stuff in there so that it is being measured and tracked, just as we're tracking patient flow as they move through a clinic.
And that's where policy becomes helpful and mandating such reporting.
Hopefully.
Yeah. Let me ask you this. What do you feel, what are the main components of the plan? So just that we can get the landscape and then we can get into more detail.
Sure. It's big, it's long. In its first version, first draft, it was 800 pages. We knew no one was going to read that. So I think it became 60. And even then, that's a bit of a stretch. So there's a one-page summary and a nice figure. At its top level, at its heart, the NHS will, for the emissions we control directly, and this, for the people sort of here who are written in, sort of is part of our scope 1, part of our scope 2, part of our scope 3, we will get to net zero by 2040. For the full scope and a few other things that are outside of scope that we're building in anyway, because we think we have a responsibility, 2045 is what we're working towards. That is a long way away. So we've also included some 80% reduction targets, 2028 and 2036 for those two scopes as well, because we want to light a fire under the system, right? We want to feel anxious. We want to feel like we have some serious work to do, reducing carbon, not in 2025, but tomorrow. That's the macro stuff. Each piece underneath that has a wedge of carbon, and each wedge of carbon has a team, and each team knows that they're going to be held to account every year at the board for hitting that reduction. And so we have strategies when it comes to estates, looking at what these 40 new hospitals that are being built look like, and what a net zero hospital looks like, what it even is, and how we make sure that we're not locking in carbon. We have a transport team asking questions about charging infrastructure, yes. How that relates to the estates teams, yes. But really importantly, some flagship items, what a hybrid hydrogen electric ambulance will look like. That's not something the market's going to solve. That's something that the NHS is going to have to solve for ourselves. The supply chain is important, and I know we'll come on to that, but there's a really important piece I want everyone to go and read, because we're pretty serious about it. Within the decade, the NHS will no longer purchase from anyone that does not meet or exceed our commitments on climate change. We need a little bit of time to figure out how, when. The mechanisms are going to be important. It's not an easy task, but we're serious about the end goal. So each team here has some high-level objectives, and they have a delivery plan. The reason I could spend days talking about it is because there's carbon everywhere, and hence it's not just my responsibility. It's 1.3 million members of staff's responsibility.
Well, I want to get back to that. That's exciting. You talked about growing the team there significantly from when David and Sonia ran it. So you must have been able to make a business case to grow the team, to make this a strategic imperative for the future of healthcare in Britain. What was the case that was made to, I got the policy context, but what was the other components of the case that were made to make this really at the center of the future of NHS?
Sure. It's three, there are three components, right? Number one, when I started at the Lancet Countdown, global average temperature rise was 0.75. This year today, it's 1.2 degrees above pre-industrial levels. That was only 6, 7, 8 years ago. The temperature is rising dramatically. Left unmitigated, it has some profound consequences for health systems around the world and their ability to simply do their job, right? The NHS was conceived in a world where we thought the climate was stable. It turns out it's not, and it turns out that a changing environment has profound implications on our ability to deliver healthcare, high quality healthcare. That's the first business case. That's the first case for action. The second one is, it turns out from the 12 years that David, Sonia, and everyone else has been working on, it turns out that quite a lot of what you want to do to respond is actually just really sensible public health. It's just really, really sensible management for running a healthcare system. We're talking about care closer to home. We're talking about personalized medicine. We're talking about keeping people out of hospitals, keeping them healthy. I mean, all the stuff that I think probably everyone spent the last, X days talking about. The final case, I think, is that this is not something that is dreamed up by a chief sustainability officer, and it's not something that's dreamed up by a sustainable development unit or what has now become the Greener NHS team, where we're a new national program. 98% of NHS staff, when they're surveyed, think the NHS should be acting more sustainably. This is something that is coming from the staff. I was talking with the nursing team, with with one of the deputy chief nursing officers the other day, talking about PPE and reusable PPE and emissions attached to that. Now, first and foremost, we have to make sure that our clinicians and patients are protected as they respond to COVID. And I said that, and the response was, yeah, no, I agree, Nick. This is not coming from us. This is coming from frontline nurses. They want more sustainable PPE. They want this, not just you, not just your program. So our three reasons are: you need to respond to climate change to be able to provide high quality care. It turns out as you respond to climate change, you get to define the future of healthcare, make it more efficient and make it healthier. And this is something that our staff want anyway. So it's probably going to happen whether we like it or not.
Love that momentum. You mentioned the supply chain. Healthcare Without Harm worked with this consulting firm, Arup, in the UK, actually, to do the first ever global footprint analysis of the healthcare sector, and we came up with a number of about 4.5% of global emissions. So that was the equivalent of over 500 coal-fired power plants. It's huge. And so the idea that healthcare takes this Hippocratic oath to do no harm, and yet it's contributing to disease and the acceleration of climate change is so against their mission. And what we also found was that 65 to 75% of the entire footprint was in the supply chain. So let's talk about that. How do you imagine working on decarbonizing the supply chain? You mentioned one thing, but let's go more deep into that.
Before, just taking a step back, because I maybe want to get your thoughts on this too, Gary. The thing I've been playing around with is I'm not sure that number is helpful, right? So yeah, sure, 70%, 60%, depending on where you are, 64% if you're in the NHS, sits into procurement and supply chain. I'm not sure that number is actually that useful, because what I feel like it does is it disempowers me as a clinician. It disempowers the individual. It becomes a procurement manager's problem. This is just a supply chain issue all the way over there, as though I'm not prescribing that drug to my patient, or if I'm a chef in a hospital, I'm not choosing what goes on my menu, or I'm not a physio who is making sure that I get those mobility aids and they are properly recycled and reused, right? There's a piece of that sits purely for carbon purposes. Fine, I understand why we break it up that way. And procurement is important, but it's just, I worry that we disempower the people that are actually at the heart of the healthcare system. Is that fair, or is it, am I misunderstanding something?
No, I think it's both and.
Sure.
It's a recognition that yes, energy, yes, transportation, all those things we need to work on. And as you're saying, we also need to understand that what we buy, how it's manufactured, whether it's part of a circular economy strategy or it's single use that gets thrown into an incinerator or a landfill, within 10 minutes, that matters a great deal. And the disconnect, I think, which you're speaking to, is that we want the clinician that's holding the IV bag to say, you know what? Does this have those phthalates in it that contribute to health problems in kids? Does that furniture have flame retardants? Is that anesthetic gas fluorine that's 2,000 times more potent than carbon dioxide, or is it a safer alternative? We need them to understand their contribution. So this is where you're totally right. It's not just, oh, those supply chain people, we'll leave it to them. There's a level of responsibility that gets pushed down to the entire system. The fact that 98% of NHS employees think it's important, that's awesome. And then the next piece is, okay, now what's their responsibility wherever they sit in the system?
Yeah.
So yeah, I totally agree with that part.
But yeah, you still have a question. Sorry.
Yes, and carry on.
Yeah. Sorry, and I guess that is helpful. Number one, we need to know where the carbon is, right? Number one, there's not an enormous amount of transparency out there in terms of sort of internationally where carbon sits in supply chains. Good reason for that. Transparency can be, used against you sometimes, right? So we need to know where the carbon is in the supply chain, and we probably need to start saying things like, listen, if you're in the National Institute of Clinical Excellence, you may not consider appraising a new drug unless you know what the carbon looks like. You may not sort of start to purchase this unless we know where the carbon comes from. So that's the first step, right? Is and there's a piece of this that probably has to involve a fair bit of engagement, because let's be reasonable, it's not an easy question, right? Figuring out for a supply chain as complex as sort of the global healthcare system where the carbon is. We're
going to help you, because we have a project, Healthcare Without Harm has a project with the United Nations Development Program.
Sure.
To design globally validated environmental standards for healthcare purchasing. And part of that strategy, and also a parallel strategy among the US healthcare systems, is to identify what are the 10 or 15 really big carbon hotspots in the supply chain identified, so that then we can collectively work together to put pressure on the supply chain companies that are producing that to decarbonize. And the fact that you're going to be requiring the companies that are supplying to NHS to match those goals will be an incredible incentive to the companies to actually make their own transformation. Because if we do it we can't do it, that's the point. We can't do it just within our facilities. We can't do it just by telling people, let's have an online appointment with your doctor supposed to come in the house. But it actually has to do with the stuff that flows through the global economy. So there's a partnership opportunity here between the systems that are on this call from around Europe and the systems in the US and globally to unite around a purchasing strategy to transform the entire global healthcare marketplace.
I'd go further, Gary. There's a partnership necessity. The NHS cannot get to net zero unless other countries and other healthcare systems are moving with it. We can't do it by ourselves. We're not an island. This needs to have everyone moving together. Now, there will be pieces of this where we will do this by ourselves, and there will be pieces of this where we have some friendly conversations and figure out the sort of direction. And there'll be pieces of this we need to do with other national healthcare systems. But absolutely, it cannot happen alone. It's.
Let me ask you, and it's great to hear that there's going to be this pressure both inside of the NHS to sort of create everybody's accountability, transparency in the supply chain. There's momentum and there's excitement among the staff of the NHS, which is an enormous employer. Let's talk a little bit about kind of the advocacy component of it, because part of what we are trying to build together, and Healthcare Without Harm is deep in this, and is the role of the health professionals, wherever they find themselves in the system, become messengers, to become advocates for policy, to educate the public. Because part of, it's different in the UK, but part of the problem that we faced in the United States is that people, until recently, until the extreme weather events came, they were thinking that climate change was some distant problem in time and space. It was about polar bears on melting ice caps. It was about glaciers receding, but it wasn't about their health.
Yeah.
So let's talk about what's the role of health professionals, clinicians, doctors, nurses, architects, dietitians, etc., in their role as trusted messengers and advocates.
Yeah, so twofold, but probably eightfold, and I'm forgetting another 6 things, but twofold, right? Firstly, I've already said it, but net zero for a health system of 1.3 million staff can't be achieved by a team of 10, 20, 30, 40, 50 people. It has to be achieved by a team of 1.3 million people. So firstly, there will be clinical decisions where we need clinicians to start to say, this is a part of my job. If you say tobacco to a young nurse, they will say, that's my responsibility. I know how to deal with that. I know that as a professional, I have a responsibility to manage that, both with the patient in front of me and also indeed across my hospital and my clinic and to the public. We need to get there for carbon and for climate change. But the second role surely is, and I think this is what you're getting at, is the NHS has some pretty significant emissions each year, 4.6% of the country's national emissions profile. That's important. What's more important is when we start to use the voice of the health profession to say, actually, when you think about climate change as a health issue, it becomes urgent, it becomes local, it becomes tangible, right? We know what, to your point, we know what a child struggling with asthma looks like. What we don't really have a sense of what it looks like is parts per million of CO2 equivalents up in the atmosphere. So the health message and the health messenger, I think, are also probably an essential necessary component to getting there, because what matters is 4.6%, but what really matters is when we start to understand and use the health system as a lever to shift the broader context, right? A hospital doesn't just exist in 4 walls. A hospital integrates across every single part of a local community.
Yeah, exactly, and that speaks to the role of the sector, because we can't, healthcare can't do it alone. So there's a role, a leveraging impact that healthcare can play to the larger society. And is that part of the strategy here, that the NHS leads and others will follow? And then the follow-on question is, what are the more immediate health improvements that we can see by addressing healthcare's reliance or addiction, really, to fossil fuels? How can we make a more immediate case for the health benefits of addressing this versus the longer term case?
Yeah. So to your question, your first question, yes is the answer. The thing I want to see that comes before that, though, before we spend our time acting as leaders out to the broader sort of community, or maybe it's in parallel, is I want to see some genuine carbon reductions, right? Advocacy is important. What is more important is doing. I want to start measuring success by reductions in tons of CO2. And I think we should start to think about that. What am I personally doing? What am I doing within my workplace to actually reduce carbon? Not over 10 years, but year on year. Right. And so to the extent that we do that and we demonstrate success, to the extent that we move away from talking about and move towards doing, I think we will build our own movement. Right. That success will be contagious, will be infectious, to, use a bad analogy. What was the second part of your question, Gary? I blanked.
The second part, what are the more immediate
Sorry.
health benefits we're going to see from moving away from our reliance on fossil fuels?
You can see it's been a long day or week or year. 2020 has been a long year. How about we call it that? Yeah, the benefits are right there in your face. That's the good thing about the health benefits of the response to climate change, is they happen immediately, right? You see air pollution reductions when you start to shift your transport networks and supply chain, and you start to provide care closer to home. You increase access for patients, right, that might otherwise struggle to get in, as well as decreasing air pollution from the transport emission reduction. In some cases, and we have some great examples of trusts across the system, you provide a nicer environment for patients to get better in, right? It's a more comfortable place, and that has some pretty real knock-on effects in terms of surgical outcomes, in terms of patient bed numbers. You increase efficiency because you end up doing the right intervention at the right time, rather than sort of struggling and over-diagnosing or over-intervening. So you see those benefits the whole way through, right? There's air, there's food, there's physical activity benefits, yes, but there are efficiency benefits and cost benefits that come. It sort of depends a great deal on the intervention we're talking about, right?
Yeah. I mean, the thing that's been so compelling in arguments, some of the systems we've worked with is they see asthma, and they see kids that live along diesel truck routes are coming to the emergency room more and more. Extreme heat days are contributing to further respiratory problems. So, the good news about eliminating the use of fossil fuels is that it helps to clean up the air, and also is the driver for the climate crisis. Which gets me to this issue. You mentioned COVID. COVID is one of the first global shocks to the entire healthcare system globally. Every system in every part of the world is grappling with that. And our view has been that the kind of preparations, the kind of threats that COVID represents to the global population are basically an early warning system to what climate change is bringing us. And so how does COVID play into, you talked about it, to really accelerate action. Say a little more about that.
Yeah, sure. I mean, these issues couldn't be closer entwined. So we must be clear, there is no causal link that we're talking about between climate change and COVID. I don't think I've seen many people say that, but it's worth repeating, right? Because the science is important. Nonetheless, your point is exactly right. This gives us a pretty good example of what happens when a healthcare system is caught unaware. This tells us just how important resilience, forward planning is. It tells us just how important the adaptation that we spend a lot of time talking about is. And how important health is, right? Health is one of those weird things, the curse of public health. You don't realize how important it is until it's not there, or until it's threatened. I think equally, COVID and the response to COVID gives us a good sense of what is possible, gives us a good sense of just how quickly some of these systems can change to save lives in response to a health emergency, right? It is nothing short of heroic what frontline clinicians are doing all the way around the world. And that, again, has probably been said again and again, but needs to be said again and again. The thing that I think we need to keep in mind most carefully, though, is that we cannot allow the pandemic. We need to be sensitive to the demands on the system. We need to understand. We need to make sure that we are prioritizing immediate threats like COVID-19, but we cannot let that slow us down as we respond to climate change. We had a conversation back in January around this, saying, well, there's a pandemic. Should we stop with the work of the net zero task force, or should we continue? And the answer was, sorry, what do you mean? Of course you continue, Simon Stevens says. Of course you continue, because we understand that the drivers of COVID are very, very similar to the mortality from COVID, very similar to the drivers of climate change. You can't let one crisis delay you from tackling another. And indeed, the Lancet Countdown yesterday, I think, came out with its 2020 assessment of sort of the state of the climate in the world. It had a really important message in there, its third message. Unless you respond to climate change at the same time as responding to COVID, you will not reach the Paris Agreement. You will not reach. Not you might not it would be difficult. It's that as of today, you have a 7.6% annualized reduction of emissions that you need to achieve globally. If you leave that for 2 or 3 years, it becomes 15.4%, and that is impossible. Unless they are combined, you won't be able to tackle climate change. So they have to be.
So that's important, because we've also, in the United States, the thing that we've seen, and I think it's also true, is that COVID is not an equal opportunity threat. And in our country, the United States, Black people have died at twice the rate of white people. So it's laid bare these deeper wounds that we have around racial inequity, health inequity. And so it's motivated healthcare systems to say, how are we going to deal with that? Because the same people who are disenfranchised, who are more vulnerable to COVID impacts, are also going to be and are more vulnerable to climate impacts. So some of the changes that people are having in their minds is linking climate, health, and social equity together, and thinking about how can we localize our supply chains, because also relying on everything coming from China has been an enormous weakness. How can we provide jobs to people in our communities, people of color, other low-income people that can actually raise up community health and wealth at the same time as we're addressing the climate crisis? Is that in the mix here with the NHS?
Yeah, so maybe to take another step back, what we're talking about is not climate change, but what we're talking about is the future of healthcare. What we're talking about is what a world-class healthcare system looks like. And that healthcare system is net zero, it is equitable, it is high quality, and it is a place we all want to be in, right? If you manage to do one without the other, you failed. It turns out science is on your side, because there's a heck of a lot of ways of linking these things together. There are a few ways you could mess it up too. But yeah, absolutely. If you're going to transform the entirety of a global economy, or if you're going to transform the entirety of what a hospital is and means to a community, you better do it in a way that is equitable, and you better do it in a way that is sustainable. Absolutely.
Well, it's wonderful to hear you say that, because we also deeply believe that's true, that these problems at a systems change level have to be dealt with together, and that we can't, because of healthcare's enormous moral power, its mission, its purchasing power, in some cases its investment, and its political power. And I feel like together we've just begun to scratch the surface about leveraging all of those assets for healthy people living in equitable, sustainable communities on a thriving planet. That's the future of healthcare. And I want to thank you for your thoughts today and your leadership, because you have a really important role to play. And as we, Healthcare Without Harm, start to build a global roadmap to follow, in many cases, in the lead of NHS, and build a global roadmap for other systems to decarbonize, to get to net zero. We're going to need to work closely together to move everybody else along. I mean, one thing that happened a couple of weeks ago is that the UNFCCC, United Nations Framework on Climate Change, they have a Race to Zero initiative, and so moving different sectors toward zero emissions. And they chose Healthcare Without Harm as their global partner to do that. And we've got this Healthcare Climate Challenge, which is about designing resilience, designing sort of decarbonization, and leveraging that leadership policy messaging role as the kind of three buckets of that challenge. And so we're hoping to globalize, well, we already have, but to really get the entire healthcare sector around the world to adopt that healthcare climate challenge. And as it'll look different. It'll look different in Zimbabwe, it'll look different in London, but all moving toward resilient healthcare, all moving toward low carbon, toxic free healthcare. So I thank you so much for your leadership, and it's been wonderful to watch your career unfold over the last decade. I look forward to when we could get back to a pub in London to continue our conversations and scheming together. And then I also just want to thank everybody who's come to this conference and is working wherever they find themselves. They're being leaders in whatever seat you sit in your institutions, to basically become planetary healers, to understand that the future of healthcare that Nick is talking about is about individual healing, it's about community healing, and it's about planetary healing. And we all have this incredible role to play together. in designing the future of healthcare for the 21st century. So thank you all for being at this conference. There's lots of opportunities to plug in, whether you're a GP or a nurse or a dietitian or an architect. There's so many places to plug in. We look forward to working with you in the future. And thanks so much for Nick for joining us, and we wish you all the best with your work. You're on mute.
I unmute myself, and thank you, Gary. Sorry, the work Healthcare Without Harm's doing is pretty damn impressive. The NHS has managed to make an impressive net zero commitment. There is no good reason why other healthcare systems around the world couldn't do that as well. The West Australian healthcare system just today has created a sustainable development unit to follow in the footsteps here. There's no good reason why, but we, I think, are counting on Healthcare Without Harm and health professionals around the world to make sure that that happens. So thank you.
Yeah, thanks everybody. Thanks. Take care now, everybody. Stay safe.